Good afternoon, everybody. I'm Dr. Heather Denniston, and this is the Junk You Should Know show. It's live every Friday at noon PST. This one we are pre-recording simply because I'm on a ski trip, everyone, and so I can't really, record a show flying down the slope. So Dr. Stephen Chen was kind enough to pre-record with me, and we are bringing you an awesome show on Kinesio taping or kinesiology taping at home. Welcome, Dr. Chan.
Hi, Evan. Thanks for having me.
Yeah, no problem. Dr. Chan, I'm going to give you a little history of him. I went to Dr. Chan when I was having some elbow issues in practice. He was short of waving a magic wand over me. He was a total miracle worker. And he does a certain kind of practice called active release technique. He has other skill sets that are just amazing. And so I knew when we were going to talk about kinesio taping, this was my guy. And so I am so grateful you're willing to come and do some demonstration today for everybody who's watching. So thank you for that.
Yeah, thanks for having me.
Yeah, no problem. So Dr. Chan, you are a chiropractor, but you've also gone on to do a bunch of other letters. I used to joke because I had a professor who had as many letters behind his name as almost the entire alphabet. And the last letters he always put was WTFC. And he'd always wait for somebody to ask what those were because, you know, you'd get through all the other ones and only the most astute person would go, wait a second, what do those ones mean? And he'd say, who the F cares? And so he made a joke of it. And you make me laugh because every time I come to see you, you are doing some kind of additional postgraduate, diplomate, certificate, some kind of thing. You are a sports practitioner, but you also have some coachings. Tell me a little track and field. Tell me a little bit about some of the additional certifications that you carry.
Okay, so some of the certifications I carry, and this is mostly just so that I can better understand and work with the athletes that I work with, are USA Powerlifting Coach, USA Track and Field, USA Triathlon, Certified Strength and Conditioning Coach. As you mentioned, I did my diploma in sports medicine and finished my program for diploma in rehab as well. But those are the permanent ones.
Yeah, and for those of you that don't know, a diplomate just means several years of hell of so many classes, so many hours, lots of testing, writing papers. You have been through the trenches, and your work shows it. So if you're in the Bellevue or Seattle area, Dr. Chan owns a practice called Strategic Chiropractic Bellevue, and I send so many people your way, Dr. Stephen. I know you know that.
I appreciate it. Thank you.
Yeah, but you have a gift and an incredible way of working with folks. But we are going to touch on kinesio taping today. For those of you that don't know what it is, Dr. Stephen, could you please explain what kinesio taping is?
Sure. Kinesio taping is an elastic-based cotton tape. So it's really stretchy. So that's different than a lot of other tapes that you see, like the white athletic tape that we traditionally see, whether it be around fingers, wrists, or ankles or feet. The purpose of the tape is threefold, really. It's to help support the joints and muscles.
Yeah.
And to also allow it to help cue the body to make sure the body knows where it needs to be, especially after injury. And then the third, as I mentioned, because it's elastic in nature, it lifts up the skin and allows the fluid to move underneath to help decrease swelling and basically help facilitate healing and decrease bruising as well.
Okay, that's great information. I actually either forgot or didn't fully know that last part about kind of allowing circulation through, and that's very helpful to know. So,
sorry. I was going to say the interesting thing actually is that's probably the most researched and the most important thing it does because it's elastic. And if you look, I tried showing this earlier, but I don't think it shows up. If you look closely, you'll see there's lines in it. And because of the lines in the weight and it's elastic, what happens is it pulls on the tissue, pulling it up and allowing for more fluid. So when you think about when you have a bruise or any type of swelling or injury, that area tends to swell up, and then the fluids become stagnant.
Okay, and so that helps with that. That makes sense. Okay, so we kind of know what it is, and lots of people are familiar with like hockey tape and that real non-stretchy tape, but this is a whole different thing. So tell me a little bit about its origin and maybe the different brands.
Okay, so its origin started in Japan. It's actually from a chiropractor. I think his name was Kenzo. Probably butchered his
It
last
is
name.
Kinesio.
Kase or Kase.
Yeah.
And originally it was designed to have the same type of stretchiness, for lack of a better word, a tensile strength as skin. So it's like a second layer of skin.
Okay.
And then eventually it became very popularized by, I think it was probably Kerry Walsh. Sorry, I'm not really good with people's names, but in volleyball for the Olympics.
Oh,
So
yeah.
they saw it on their arm and their hips, and then people were like, what's going on with that? And then since then, you've seen it in the Olympics and other types of major sports and athletics where they're all, covered up.
Certainly. Yeah. Okay. So that makes sense. And so that guy, I've seen him before. He always wears cool glasses and crazy white hair. And so he obviously made it rich off his brand, but we know there's other brands out there.
Sure. Yeah.
Do they differ from each other?
Yes. So they do differ a little bit. I mean, the main differences are in how sticky they are, so the type of adhesive that they have. I mean, they're all acrylic-based adhesives. And then durability.
Okay.
So those would probably be the big ones. And then some people, they just like the different colors, and certain ones look cooler. And that's just more color preference. But there is a difference. Some of the probably more advertised or bigger brands like Rock Tape, which is one that's advertised a lot. I have found that it is a little bit stretchier and it is stickier, so their claims are true that way.
Okay.
But a lot of the off-the-shelf stuff that you buy, say at whatever department store or grocery store that you go to, they typically don't last as long, which is fine because you don't get as lucky. Because a lot of times this tape's lasting for anywhere between 3 to 5 days. So
3 to 5
you're showering, and you're using it, so it can get kind of gross for a lot of us.
Yeah, I think that's a good point. That some of the more the higher quality brands are going to run with a higher price point, but your point is that some of the lower brands may not last as many days, but it may be enough of a cost difference. Then who cares if you have to put a strip on 3 days instead of 5 days or whatever. Okay, so that makes sense. So there's different, like I've seen, you can get pre-cut, like you can go and buy like a shoulder one or a knee one, or you can just get the strips. So what's the difference there?
Okay, so I actually have one here. So this is a big roll.
Okay.
You can see, so it's the size of this roll here. We have a pre-cut, like you said. So you can see these are pre-cut and the edges are rounded. Okay. And then there's ones that are pre-shaped, meaning it's actually pre-cut and pre-shaped for the region of the body. So this is a knee one through spider. Oh. You can see how, and then on the backside you can see the numbers and instructions how to put it on. I mean, I think this is great in terms of a simple solution, but the problem with it is if you look at the instructions, I mean, they're not short, right? I mean, this is just one side of it. So, I mean, for most of us, that's a lot of work and a lot of reading. Not only that, too, I mean, you look at this shape, and this is a knee. Well, the question I have is, well, whose knee is this? Is this your knee, my knee, like a 12-year-old's knee? So it's going to differ based on the person. So that's the advantage of having a roll where you can cut it, so you can cut to measure. So it's more, I guess, bespoke for lack of a better word. The thing about these ones that are pre-cut, if you're lucky enough, or if you just happen to be using it on the area that happens to be this size, that's perfect, right? Because then you can travel with this. This is easy. You don't need to deal with the airports and scissors and stuff. So it's just, these are a little bit easier that way.
Yeah, that's great. That's a really good point. I hadn't actually thought about that. So, and I found, I mean, you can find some pre-cut versions, but really if you're shopping on your own and you're wanting to do this at home, most of the time you're going to be finding just those standard sizes. And probably maybe you should stick to that just because of the points that you made there about size and complexity and all of that.
Right, yeah. So, and we'll probably go into that with some of the taping later, but it depends on how complex it is and really what the goal is that you're trying to achieve with this taping.
Okay, yeah, that makes total sense. So we talked a little bit about like how it works, but if I'm struggling with an injury or a bruise or whatever, like kind of what's the purpose? I know we talked lift, skin, flow. I guess I'm thinking if I'm somebody with an injury or whatever, how do I know that this is something that I should be thinking about doing or that I might want to do?
Well, if you feel that, like I said, so those 3 points, So for bruising and swelling, it's really straightforward. Right? You can just put the tape over that area with a certain amount of stretch. And like I said, that'll help lift the skin. So an example of that would be if you have, let's say, a large bruise here on your forearm, and you cut a thin strip and you ran it over, not the entire bruise, so that the bruise is on either side of it. If you left that on for about 2-3 hours and you peeled it off, you'd actually see that it would be lighter underneath that. And there's lots of pictures you can go online and you can take a look how it helps, because it actually helps the circulation underneath and allows the tissue to heal. A lot of bruising, as you know, is just stagnant blood.
Yeah. Oh, that's fascinating. Okay, that's cool. Okay, so let's move into kind of the steps of how to do this. We talked about in the title that kind of here's like the five things to do. So we talked a little bit already about when to use. Did we miss anything on that step, on the when to use step? You talked about bruising sprains, right? Bruising
sprains. So like I said, the other thing is, like I said, again, if the area feels like you feel that it needs more support. So certain conditions, such as plantar fasciitis, which is a common one, you'll want your arch or your plantar fascia more supported so it's not chronically inflamed. Right? So in an instance like that, perfect. That'd be a good thing to use that for. You know, you've seen it typically for low back, shoulder, but we'll get into that because it's a little bit more complicated than that in terms of especially trying to tape your own shoulder.
Yeah, that makes sense. I know for myself, one of the reasons I wanted to do the show is because I've had 2 horrible grade 3 ankle sprains in the last 12 months, and doing some taping on them has been incredibly helpful. And I can't go, I'm often out of town, so I can't come see you every time. You know, my question was, why don't we talk to people about when it's appropriate and not appropriate to tape yourself at home? So let's just talk about the how-to, the preparation. What does that involve?
Okay, so the preparation, first thing is you want to make sure that the skin is clean and dry.
Okay.
Right? And then, so that means taking off any moisturizers and things like that, because the adhesive's just not going to work as well. If you just got out of the shower, you put on your moisturizer, you try to put on a piece of tape, or even a Band-Aid for that matter, it just won't work as well, right?
Yeah.
So we really want to make sure that it's clean and dry. And then after that, if it's a hairy part of the body, or if you're just a hairy person, you might need to shave that area.
Okay.
Because it's not going to stick as well.
And it's going to hurt coming off.
And it'll hurt coming off, exactly, yes. And that's never fun. And then the last thing is just to make sure that there's nothing going on with the skin in terms of abrasion, bruises, rashes, things like that, because you don't want to be irritating the tissue. You don't want to sensitize your skin to the adhesive, because it's a commonplace adhesive too.
Yeah, so rashes, scrapes, anything open, that kind of thing, just don't do it.
Just don't do it.
Okay. So that's preparation. You don't have to does alcohol help? Do you need to do that?
I mean, if you're a really oily person, you might need it. And it's not necessarily a bad thing if you're oily. I mean, hopefully you stay younger longer too, right?
Right.
But it's one of those things where, alcohol can help.
Okay.
Alcohol definitely can help if you have oily skin.
Okay, that's good. So the application, this is the big one, right? This is the toughest part. Let's talk about that. And I know you have a lovely assistant there who I'm sure is going to be coming on camera here any moment, but tell me a little bit about the application process.
So the application, typically, because it depends on the part of the body, you want to be applying the tape above and below the area that you want to be taping, 2 inches above and below.
Okay.
And part of the reason for that is on both ends of the tape. So on both ends of the tape, let's say it's 2 inches between here and here, there should be no stretch between here and here. The stretch should only be between here and here.
I see. Okay.
And the reason being is actually because it becomes quite irritating for your body and your brain to have something constantly pulling you on the ends.
Okay.
So you really want to make sure that the ends, that there's no stretch. And you would see that on videos online. There's no stretch applied.
Okay, that makes sense. And then I think I was taught that you peel the layer off a little bit, put it on the skin, and then slowly peel the rest as you're putting it on the skin. Or do you peel the whole thing off and then you have this sticky piece and you stick it on? What do you do?
For sure not the last one. For sure not the last one. The reason being is if you peel off all the adhesive, if you peel the backing off, what's going to happen is you're going to be using your fingers all over the adhesive here. and that's just not going to stick very well.
Yeah.
On top of that, what's going to happen is, because you've used this before, you'll know that when you peel it all off, all bets are off. This stuff's going to stick to itself too.
Yeah.
So what will happen is you'll start getting crimps and folds in it, which will tend to lead to blisters and irritation underneath the skin.
Okay.
Because you're going to have this little fold or pucker in here that depending on the body part, that's going to be rubbing against that. Especially if you imagine underneath your foot.
Yeah.
It's kind of like having your sock not pulled all the way up. No one likes that.
No one likes it.
Yeah,
No.
plus it just starts to irritate things.
Yeah, it does. So just
to your point, yeah, you want to. Typically, what I do is I'll figure out, let's say that 2 inches or this amount through here.
Okay.
I'll fold it because it's just easier. I like things easy for me. And then what you're going to do, I'll face the camera as I do this. I'll rip it along that fold. So now I have that fold.
Yeah,
right?
That's great.
And then what I'll do, so that I don't have to, like I said, touch the adhesive, is I will take off this piece here. Okay. Now there's no stick, and then I'll just put on the floor. Put this down with no stretch.
Okay.
And then, like you said, you can either, because there's already on the tape itself, it's stretched on the tape, so you can either apply it with no stretch, which is probably anywhere between 0 to 25% stretch, so you're just putting it on, or you can apply stretch depending on what your intent is.
Okay.
And then at the very end, again, you'll see that it's not touching down. There's no stretch. I put it back down, and then I rub it to apply the adhesive.
Okay. There was a couple things there I did not know. So, I'm learning as we go here, Dr. Chan.
That's good. You gotta learn every day, right?
That's right. That's great. So just recapping, 2 inches is your contact, and then the thing I picked up is the tape already has stretch, so you can apply it as is, or you can stretch a little bit more.
Yes.
Okay, and then those last 2 inches, down they go.
Yeah, let me just show it to you again a little bit, just because the thing is, I know a lot of people, if they've never used or seen this tape before.
Okay.
So you can see this is the tape here, and I'll just fold it in the middle. Okay. So you can see that there actually is stretch, because when I do this, you see that breaks?
Oh, yeah.
And then if I do this, it actually will overlap even more than itself. So you can see this tape is stretchy.
Yeah, okay. That's cool. That makes more sense.
Does that make sense? I know, because a lot of people, you can't see it.
Yeah, I was thinking I had to put all this stretch on it, but in fact, you don't have to do that. It's already on there. Okay.
And again, that depends on your intent, right? So if you're going to put, let's say, and these are arbitrary numbers. I mean, this is what we're taught, but it's kind of an arbitrary number. If you go between 0 and 50% total stretch, that's to support a muscle. If it's 50% and above, you're going to be supporting a joint. If it's less than 25%, then you're going to be working more with circulation. Does that make sense? Yeah.
Yep, it totally does. It totally does. So, of course, before we talk about removal, we're going to look at a couple taping ideas and jobs and suggestions, because there's areas we should tape on our own or can tape on our own, and then there's areas that you don't recommend. So,
right. So I'm actually going to show a tape job for your shoulder blade or upper back, just because a lot of us, the issue is, we all slouch too much now. Technology, or we don't listen to our mothers or whatever reason. We all slouch too much now.
Yeah.
So I'm just going to show you a simple application. The reason I picked that one is because you can't really do it yourself. I mean, you can try it, and if you want to, I'm sure you can send videos to Dr. Dennis. You can probably find things like that. So I'm going to bring over my lovely wife for a second, and we're going to tape her shoulder or upper back. So the issue is, like I said, typically her shoulders would round forwards just like this. Right? So,
but because she's married to a chiropractor, she has perfect.
Oh yeah, so she never slouches. Just like all dentist kids never have cavities either.
That's right.
Okay, so the premise of this is we're going to try to tape it so that it cues her body. So we're not trying to brace her body. So a lot of people think, oh, we're going to tape this in a way or manner such that she cannot slouch. And that's not what we're really after, because, just like with back braces or neck braces, you don't want to be in a position braced too long, because what's going to happen is the muscles are going to become weak. Mm-hmm. Right? So we really want to make sure that we're cueing the body. So you can imagine, before we do this, that as she slouches, if her skin became tighter on this spot, that will be uncomfortable for her. So then it'll cue her to do that. So that's really the goal of this. Okay.
Good.
So I've already pre-cut some tape. I'm going to turn you just slightly this way. And what I'm going to have you do is extend your arm and slide it externally over to the shoulder. And you'll see that we need to prep the position of the body first. And this is what makes this hard, because a lot of times when you see it, and even patients, they'll be like, oh, can you take a picture of me with this tape on here? And I'll be like, I can take a picture of you with the tape on. The problem is it's not going to be doing as good a job of what it's intended to do. Because what we're doing is we're positioning the tissue, we're shortening the tissue, we're putting in that position, and then we're using the stretch of the tape to further facilitate that.
Yes. Okay. Got it.
Okay. I just want to make sure. Turn a little bit more, please. So again, no stretch. Okay. So this, and again, you can see with bra straps or sports bras, I don't know how you do this yourself.
Right. Yeah. This one would be definitely a tough one to do yourself.
And then again, no stretch at the end.
Nice.
And then I rub the adhesive in. Sometimes you'll see on videos where people will be like, oh, so you take this side and you use this. So the only reason that I could foresee why you would do that is so that you don't accidentally flip your finger underneath to roll it underneath. So the thought is, well, if I do this, otherwise there's no reason to use this.
It's not magic.
It's not magic. There's nothing to it, and that's the reason. So just relax. And then so she should feel this just gently stretching it. So
Okay.
when she starts to slouch around, it just reminds her to cue about that.
That's great. That's
Okay.
great. Okay, what else are we going to take?
Other positions that you really want, or areas that you really kind of want to avoid are going to be armpit, especially men, a lot of men for hair reasons. Inside the front of your elbow,
Okay.
back of your knee, just because those are very sensitive areas, and it crimps, and if you do it, you just find it very
Okay.
okay.
That
So we
sounds
really
good.
want to work on that. We'll do tennis elbow as well, because
Okay,
it's a common complaint, right? So again, for your forearm.
That's great.
So just hold your arm up. If your arm gets tired, let me know. Or just start shaking. Or just,
Now,
so
Dr.
I would measure it out.
Is this one that you've seen patients be able to do on themselves?
Yes, it is. But all of them are harder to do. I mean, like,
Yes.
it's doable, but it's just harder. Right?
Yeah.
So I measure out the first piece, and then I measure out the second piece over.
Okay.
So I've done this enough times.
Those are monster scissors.
So these are these are scissors. So these are Teflon coated. Oh, these
They're serious.
This was I actually bought this from Kenzo, and look at the inside of that. It's
Oh,
felt
okay.
velour.
They have their own.
They have their own. So every company has their own. So,
Okay. That is,
but you can use regular scissors.
Okay.
There's nothing special about it. I just decided to drink the cream and get it. So I'm going to cut the corners off. And one thing you'll notice, and you just one thing you'll notice is, so a lot of times with applications, you'll see the edges or corners cut off. And again, there's nothing special about that other than they won't catch. So they won't roll up as easily, so it'll last longer. And this is especially somewhere where you need to be mindful of, like in and around shorts, like around your knee, if you're doing a taping application, or around your elbow, where you're doing a shorter sleeve, because the shirt or the item of clothing will continue to rub against that area.
okay.
Okay. So just for time's sake, I typically fold it in half so it's over itself, and then I just cut round.
Oh, that's good.
It's just faster.
Yeah.
Okay. And I'm going to do the same thing on this other side. Okay. So let me just let you on then.
That's perfect. We got to
So,
get
yeah, so if you have, the complaint is if you have tennis elbow or lateral epicondyle. Okay.
Okay.
So again, we're going slightly above the complaint. Okay. No stretch.
Dr. Chan, does it, see you're going from the joint distal down.
Yes.
Does that matter?
Okay, so it's good that you brought that up. Originally, when you're taught, so through the original Kinesio tape company, and through Dr. Casse, sorry, I apologize for butchering your name. They did say it actually makes a difference whether it be distal to proximal, because or vice versa, because what they're trying to do is they were trying to tape it very specifically so that it's either pulling this way or pulling this way, because if it's a muscle or joint application.
Okay.
Right. And so it does make a difference. And for a lot of people who've been taping for a long time, just relax for a second, you'll see people cut into a Y shape, you'll see an I shape, you'll see X shape, and those are all for different applications.
Okay.
There's been some research that show that, it doesn't seem to make a huge difference.
Okay.
Also, in terms of just teaching people, it's easier to not have all these different techniques.
Yes.
So in terms of efficacy, I still tape it. Like I will cut, I'll show you actually quickly after this. I still cut mine like in a Y shape because that's how I've done it in the past, and it's worked better for me at least.
Okay.
But there's nothing wrong with doing this way as well.
Okay.
Over.
And that's about how far down from the elbow joint? So bend her
elbow joint is here,
okay.
so you can see it's approximately 2 inches above.
Okay,
right?
got
and
it.
We're trying to stay away from
Great.
front of the elbow, just because it doesn't feel too great.
Okay.
And the thought process behind this and the premise is so that when she's flexing her wrist, the tension that she's putting in through here, there's less tension on this spot, and at rest also because, like I said, this is pulling up. It allows fluid, so it allows the tissue to heal quicker.
Yeah, that's great. Good support there.
Okay.
Awesome.
I said I was going to show you the other one just for the sake of, I guess, demo.
Yeah.
I'll cut this one in a Y. So it takes a little bit. So you can see this cut like this.
Okay.
The one.
Pants. They look like pants.
Yeah, they look like pants, yeah. And you'll actually see some of these larger because they come in different widths, like a four.
Okay.
People will cut several and it'll look like a little squid. And you'll see it, yeah, like if you look back and with that type of application where it's kind of like a squid or using arms, the thought is to pull that whole larger broad area up so that it decreases swelling in a larger area.
Okay, I can see the thinking behind that. It makes sense.
All right. We got 2 elbows. So again, slightly above. And so for a lot of these too, what we'll do, and I didn't do for this, is we'll put it into the stretch position.
Okay.
Right? Or extended, depending on what you want to do.
Okay.
Right?
Just
so you can put it in extended position.
And this is actually, that point right there is a really good point to say, you can tape at home and it's fine, but there are so many nuances that you are not going to know because you're not a doctor who's trained in taping. So we just, keeping that in mind that yes, you can do some of this at home, but I mean, really, if at all possible, you want to be going to your chiropractor to have them do it for you, or a physical therapist who's trained in that, so that they can apply it better. And not to say that you can't do it at home, but just nuances that we're missing. We just have to.
Yeah, that and the thing too is sometimes you don't need to.
Yeah. Yes.
Right. So but not being a trained professional.
Yes.
You don't know when to go or not. Right? I mean, you could take a fracture, but
that one's pretty.
Still broken.
Yeah. Right.
So you can just see. Yeah, you see.
That one's super pretty.
Yeah.
Are there any? Have you seen any like total contraindications? Obviously, if there's any suspicion of a fracture, we talked about rashes, that kind of thing. But from a joint, like, is there certain tendinitises or sprains or whatever that you just would say, no, that is just not a taping thing?
Well, the nice thing about this tape, so that's a good question, but the nice thing about this tape is really outside of skin issues, you're not going to really make things worse. You're not going to really irritate things too much. It's really a skin issue. Like if you put tape over a fracture, people are just like, your providers are going to be like, what are you doing? But you're not going to typically make it worse. Okay, so great. That's the good thing about it. It's really just being mindful of, hey, is this irritating my skin? So the same with even just once you're taped. If this starts turning red, or if there's blistering, or if it feels itchy, take it off. Because we don't want you scratching it to get the adhesive into your skin and getting it. Now you have 2 issues, right?
Yes, yes. Okay. So let's talk removal, because the other day I pulled some off and I ripped the crap out of my ankle. So tell me what I did
So let's
wrong,
look at
Dr.
removal.
Chan.
All right, so you pulled the skin off, okay. So I'm gonna take this one off first, and just because it's easier to demo. Let's go a little bit closer, please. Okay, so there's a couple things you need to be aware of when you're removing tape. One, you wanna go with the grain of hair. So for example, you know, like her hair would go this way. So we don't wanna be like that. I mean, unless she wants me to be waxing her at the same time.
At the same time.
You know, that'll be an extra service. So we really want to make sure that we're not doing that. The other thing we want to make sure that you're doing is that when you're pulling fairly at a steep angle. So what's going to happen is, I'm going to move this a little bit closer.
Yeah, that's
when
great.
you pull, you can see all her skin coming up.
Yes.
Whereas if I pull at a steeper angle like this, it's not going to be doing that. Even better than this is going to be if you put your fingers underneath here, like on the non-sticky part, and you just trace your fingers along there. It's when you rip up like this, you can even see, you see our skin's puckering or pulling away. That's not going to feel good. Yeah, yeah. So you really want to be making sure that you're pulling it off that way.
Okay.
The other thing that you can do is, let's say that thank you, lovely arm model. The other thing that you want to do is you want to make sure that if for whatever reason it's on an area of your body where it's just really not coming off, you can take any type of oil. So it could be like a baby oil, corn oil, olive oil, saturate that area just for about 10 to 15 minutes so that it breaks down the adhesive, and it should come off. You can still follow the same rules, kind of go, you know, at a steep angle, pulling that stuff off as well. The other thing that I've heard of, but I've never personally tried, and I don't know, and I've never really recommended it, but it's out there, so is showering with that area and getting it fairly wet, and then really lathering up, sudsing that area. So again, it's to break down the adhesive. Okay.
Okay. So soap or oil, have some patience, give it a minute, and then use the angle. And that was my mistake, is I was not thinking, and I just pulled straight up, and then
one other thing.
Yeah,
and one other thing. In general, after you shower, because you can leave, like I said, 3 to 5 days, so I don't expect people to be all stinky and gross. Shower, please shower, right? But blot dry that area, because it's cotton, so it's going to be wet, like when you're using it for subsequent days. But when you're ready to take it off, let it dry first. It actually will be stickier and harder. So like if you go in your shower, you go, I'm going to take it off after I shower, it's going to hurt more. It's going to be harder to take off. I did. Yeah, well, that's okay. Live and learn, right?
Live and learn. Yeah, so that's super helpful. Okay, well, that's great. Well, I think, I mean, I think we covered that. Like, my advice to everybody, being a chiropractor myself and also being a home user of Kinesio tape, seek professional attention before you start taping yourself all up. See if it qualifies as a taping if it's conducive for taping, and be shown how to do it correctly. See someone like Dr. Chan. And if you are taping at home, just follow some of these recommendations that Dr. Chan has been kind enough to offer us today. Is there anything that we missed?
I can't think of anything that we missed. I think we touched on all the topics.
I think we did too. And I'm so happy you brought along your assistant today. She's just lovely, and I appreciate that she was willing to lend a hand, so to speak. I know she can't hear me right now, so you can tell her anything that I said. So
she says you're a wonderful arm model. Best she's ever seen.
Yes, thank you. Great. Well, Dr. Chan, thank you so much for joining us. Again, you own Strategic Chiropractic in Bellevue, Washington, and and you work with lots of different sports teams and athletes and all sorts of stuff. So and one of the things I will say is I've had several patients or friends or whatever who are dealing with these tendinitises, let's say carpal tunnel, tennis elbow, and they are about to go get surgery, and I've sent them to you, and they have ended up not on the surgical table. So I just want to say that some of the work that you do, including the taping, the active release technique, chiropractic, all of those things are pretty magical. And so I do appreciate you very much, and want to thank you for joining me today.
All right. Thank you very much.
Okay, great. All right, guys. Listen, it's the Junk You Should Know show again. I'm Dr. Heather Denniston. We're here every Friday at noon PST. Please join us again. And we'll be seeing you next Friday. Everybody have a great weekend.